Yeah, let's go. Yes. Hello, Sufyan Khan. It's Stella here. Thank you so much. We are in the block number 3 finally. And then I do have a couple of questions to ask for you before we close this block. And I will open for Q&A questions. Let's go. I would like to listen now, Sufyan Khan, very quickly about, let me know question number 1, okay, for the block 3. How about your strengths and your weakness? How about your strengths and your weakness? Go ahead and let me know in further details about your strengths and your weakness. 5 minutes, please go ahead.
Well, yeah, my strengths are I'm quite hardworking and flexible. I can adapt in uh, in different conditions, and I can adapt the environment quite efficiently, working with interdisciplinary, either it is working with interdisciplinary teams or in the uh, gym or with other members of the team, either it is nutritionist or other interdisciplinary persons. I can quite flexible and adaptive in this manner. And yes, I am quite hardworking, and I usually focus on my work on manual therapy. That is my strength, because a lot of people usually go on the traditional method or traditional physiotherapy method. The manual therapy is my another strength. Uh, yeah, and my weakness are I am quite punctual, and sometimes I do take more time to treat a patient. That can be my weakness. I do usually work with a particular time frame, but when uh, I don't get enough response from the treatment, I usually give more time. That is my weakness, because certain times we have to go in a specific time manner. And another weakness of me is I usually I am quite shy, but once I get start the conversation, I do become friendly. That is my weakness, because certain times, due to this frankness and friendliness, uh, patient do not take the rehabilitation plan seriously, because like he can understand my thing, or they don't follow the rehabilitation program religiously. That led to the uh, predicted outcomes of the rehabilitation program that we have standardized ourselves. This can be a weakness.
Wow, well done, well done. Thank you, much appreciated. Okay, so I will ask again this question, okay, because I would suggest if you can improve the level, increase the level of the voice, it's much better. Maybe it's the connection, maybe it's the microphone, but I would like to listen you more clear, okay? If you can just increase the tonality, the level of your voice, it's much better. And yeah, let's go for the question again. Sufyan Khan, let me know very clear and concise your strengths and your weakness for this job role. Your strengths and your weakness for this job role. I would like to listen. Let me know.
Well, one of the strength one of my strength is I'm quite hardworking. Focus on manual therapy that need more physical work. This is my basic is because I focus on manual therapy more than the traditional method of physiotherapy. And another strength that I have is I'm quite flexible and adaptive. I do adapt the environment of I do adapt different environment that can be that can be beneficial in different condition. Like it is not like I can work only in clinical basis. I can due to this quality I can work in gym sort of thing, or on field, or in other athletic programs with because I can adapt quickly in different settings. And as far as my weaknesses are concerned, I am quite punctual. I do work time, but sometimes when I treat certain patient and I don't get the expected result within the 45 hours, 45-minute session, I do go beyond the time limit. That can be a weakness for me because there is a specific time limit that we have to follow so that others we can manage all the caseloads specific time. If I would go, I will give more time, all the patient days or caseloads will be affected due to this thing. And the other thing is, initially I am quite shy with new person, but once I break the ice, after that, I became frankly and friendly with the patient. That can be a negative point for me because certain time patient or like when we maintain a friendly relationship with the patient, that can affect their participation in the exercise when they are at home, because they are like, if we want to exercise, our therapist will be okay, will understand our uh, things. It is like that. That's why these are the two weaknesses.
Wow. Well done. Very good. Yeah, very good. Thank you so much. Much appreciated, right? Uh, another question. Sorry, question number two, right? For the block three. How do you handle situations with aggressive patients, abusive patients, or how do you handle misconduct behaviors from patients? Go ahead. You have 5 minutes for that question. Okay?
Well, these things usually don't happen uh, to me. But if this thing will happen to me, I will just if there is a abusive person or person who is going to harm me physically, first of all, I would just calm him down and talk, by conversation. And if he's not going to calm down, then I will consult my manager or physiotherapy manager or another admin department so that he can um, cool down this situation. If these things are not going to work, then we will just call the guards or security and take him out of the spot.
Wow. Super. Well done. Okay. You mentioned that this kind of situation don't happen with you in the past, is it?
Yes, it is. Yeah, it is. It doesn't happen to me.
For you,
Not at.
never in your whole
Yeah.
career, you never handle situations with aggressive patients, abusive or misconduct behaviors.
No, no, I haven't gone through this situation.
I got it. Yeah, I got it. Okay, that's not a problem. Let's go. Question number three. How you handle misconduct behaviors from colleagues? How do you handle misconduct behaviors from your colleagues in the job or someone from the staff? It's one staff member, and then the guy, it's the guy have misconduct behaviors. Okay, just imagine about misconduct behaviors. Okay, Can it be oral? Can it be physical? You know, or another kind of things. But let me know how do you handle misconduct behaviors from one colleague?
Well, initially I would just go to the person and ask what is the problem, what is the underlying cause that he is doing this sort of uh, thing to me. Either it is their either it is their home related problem, or either they are having problem with my attitude or any sort of other thing. Uh, First of all, I would go for one talk with the person who is doing this sort of thing to me, and try to figure it out and solve that thing. If this thing will be solved at that level, then it's okay. If it is not going to be solved at that moment, then I would just warn him that I'm going to complain the higher authority. And if that thing happens often or routinely, then I will just give the written complaint to the higher person that I am going through this condition.
Okay, well done. Yeah, yeah. Well done. Totally, yes, totally fine. I totally, yes, I totally understand. Okay, very good. Super. Yeah, you have another question. It's quite similar, right? Question number 4. Do you have one specific technique or tools to handle misconduct behaviors toward one colleague?
Well, yeah, initially I would just go and calm down the situation. If he on the spot, if he's doing some sort of misbehave or some sort of other thing, if it is not going to work, then I would just involve a third person to sort it out. Maybe a higher authority or higher person. This is the technique that I would go for.
Okay. Yeah, you solve the situation uh, talking with your hiring manager, your supervisor, correct?
Yeah, yeah, the person who is going to look after these sort of things, like admin or the head of the department or any other person.
Yes, I got it. Super. Okay, that's perfect. That's perfect. That's all right. Yeah, let's go for the question number 5. Question number 5. Let me know very clear number 1, number 2, and number 3. The name of the techniques, the exactly techniques, tools, methods that you are capable to do, you feel comfortable to do, and you are high skilled, you are high, skilled guy, you have a lot of qualifications, a lot of practice in these 3 tools. Okay, can be one tool, one technique, one method, whatever. I would like to listen very clear about these tools, these techniques on a daily basis that you are capable and you feel comfortable. You feel comfortable to use. 3. Let me know only 3. Go ahead.
Yeah, there are multiple things that I am